Hi everyone. Thanks for taking the time to join Blue Shield of California for this quick video. Today we're going to explain some options for non-employer sponsored healthcare for California residents. As we go through the presentation, you'll notice our slides have links to other resources, so make sure you download the accompanying PDF document so that you have access to those resources. If you have more questions after this video, please connect with us through the email address on the screen. Here are the topics we'll go over today. First, we'll explain how your options will be based on your circumstances. We'll then touch on COBRA and Cal-COBRA. Next, we'll move on to Medicare, then Medi-Cal, and finally, individual and family plans, also called IFP. We'll also cover households that might qualify for both IFP and Medi-Cal plans. After you have a better understanding of these programs, we'll talk about your next steps to get covered. In our last section of the video, we're going to give you more details on the IFP plans offered by Blue Shield. We understand that these are challenging times for our members and community, but we also want you to know we're here to ensure that all Californians have access to high-quality healthcare that meets their unique circumstances. We'll go over the different options for you and your family if you've lost employer coverage. You decide what works best for you based on your unique situation. We're here to help guide you on the next steps. Your options for health coverage are driven by your unique circumstances. For instance, is your employer still offering health coverage but changing their contribution to it? Have you been furloughed or had hours cut? Will this result in reduced household income for you and your family? Have you been laid off and are now without an income and employer coverage altogether? Here's a list of the health coverage options we'll be going over that could work for you. COBRA or Cal-COBRA. Medicare. Individual and family plans. And Medi-Cal. All four options here meet what the federal government deems as minimum essential coverage, which includes preventive care, prescription drugs, hospitalization, labs, and more. We also want to stress here that as long as you apply on a timely basis, all of these options are guaranteed issue, and any pre-existing conditions will be covered. COBRA or Cal-COBRA is continued health coverage through your employer when you leave or lose your job. COBRA allows you to continue the same coverage, but in most cases, you'd have to pay the full cost of the premium. There may be certain cases where the employer arranges to pay a portion of your COBRA payments for a defined amount of time. If you choose COBRA as your health coverage option, your current benefit designs and provider networks are retained. COBRA is an option for you if you lost your job, you're not entitled to Medicare at this time, and your employer is still offering health coverage to current employees. If the company has decided to no longer provide health coverage to any employees, COBRA won't be an option for you. If you're considering COBRA, it's important to comply with the application deadline, which is 60 days from the date of notice or loss of coverage, whichever is later. But keep in mind, if you decide to opt in on day 60, you'll still have to pay back to day 1. COBRA is a federal program for large employers, and it's good for 18 months. And then Cal-COBRA, which is California's COBRA program, kicks in for another 18 months, making the total coverage time 36 months. For small employers, Cal-COBRA covers for up to 36 months. Here's something to keep in mind if you're debating between COBRA and moving to IFP. If you've already incurred claims and satisfied your deductible or out-of-pocket maximum, it won't translate over to an IFP plan. The only way to maintain that credit is to stay put. Medicare is a federal health insurance program managed by the Centers for Medicare and Medicaid Services for people who are 65 and older. Medicare is also for people under age 65 with certain disabilities, as well as people with kidney failure, also known as end-stage renal disease. Medicare can be an option for you if you've lost your employer health coverage and you fall into one of the above categories. The time for most people to apply starts 3 months before their 65th birthday and goes till the 3rd month after their birthday month. If you're interested in Medicare, your broker or Blue Shield can help you understand your options. Medi-Cal is free or low-cost health coverage for California residents with rich, comprehensive benefits. It might be an option for you if you don't have employer coverage, for instance, because you lost your job or had a reduction in earnings, and you meet the eligibility guidelines. Many Californians will find that they qualify for Medi-Cal. In fact, 1 in 3 Californians is on Medi-Cal, making it one of the largest health programs in the state. Most people with Medi-Cal won't have to pay for their care. There's no special enrollment period for Medi-Cal. You can enroll any time of year. Medi-Cal is unique in that if you're determined to be eligible, your coverage begins immediately. Coverage goes back to the first day of the month in which the application was submitted. To apply for Medi-Cal, you can contact our Blue Shield Promise Health Plan team if you live in LA or San Diego County, or if you live outside of these areas, you can apply at coveredca.com/Medi-Cal. An individual and family plan, also called IFP for short, is coverage for people who don't have coverage through their job, through Medicare, or through Medi-Cal. IFP members purchase insurance on their own. IFP may be an option for you if you don't have employer health coverage or you lost it, you're choosing not to receive COBRA from your employer, and you're under age 65. Your broker or Blue Shield can help you understand your IFP options. There are 2 ways to get individual and family plan coverage. The first option is to purchase it off exchange, which means you get it directly through a health insurance company, such as Blue Shield. California residency requirements apply. The second option is to apply on exchange, which means going through the state marketplace, also known as Covered California. You would choose this route if you think you might qualify for financial assistance. On-exchange applications will require California residency, as well as financial, citizenship, and immigration eligibility to apply. Here is the income chart that is used to determine if you qualify for financial assistance for both on-exchange as well as Medi-Cal coverage. You would locate your household size on the left, and then find where your income lands on the chart. Depending on where you fall, you or someone in your household could qualify for Medi-Cal for adults, Medi-Cal for pregnant women, Medi-Cal for kids, cost-sharing reductions on the exchange, federal tax credits on the exchange, state subsidies on the exchange, or a combination of several of the above. If your modified adjusted gross income is higher than what's listed here, you might be a good fit for an individual and family plan off the exchange. There are also situations in which households have family members who fall into on-exchange coverage and Medi-Cal. Here's an example comparing 2 families, both with a household size of 4 and an annual modified adjusted gross income of $51,000 per year. In scenario 1, there are 2 parents and 2 adult children, for a total of 4 adults. All 4 family members in this case would qualify for coverage on the exchange with federal tax credits and state subsidies. In scenario 2, there are 2 parents and 2 children. The 2 adults in this case would qualify for coverage on the exchange with federal tax credits and state subsidies. The children would fall into Medi-Cal because Medi-Cal has a higher income threshold for children. Here's a list of some of the common income types that can be used to calculate your modified adjusted gross income. This is income that will be used to determine your eligibility for both Medi-Cal and on-exchange coverage. Keep in mind that federal and state unemployment benefits count as income. However, federal stimulus checks that will be sent in response to COVID-19 do not count. Enter your modified adjusted gross income into the subsidy calculator to see if you're likely to qualify for federal tax credits or state subsidies on the exchange, or free coverage through Medi-Cal. If you don't qualify, off-exchange coverage is likely to be an option for you. Here's a quick side-by-side comparison between off-exchange and on-exchange coverage to help you decide which of these options works best for you. With off-exchange, you'll have the same plan offerings as on the exchange and more. Because you won't be receiving any federal tax credits or state subsidies, no income, employment, citizenship, or immigration documents are needed to apply. You'll just need proof of California residency. On the exchange, you might qualify for federal assistance to lower premiums and cost of care, as well as state subsidies to help lower premium. Some of the documents that you'll need to apply include proof of California residency, Social Security numbers for applicants, immigration documents for non-citizens, income information such as pay stubs, proof of unemployment benefits, and your employer's address, as well as federal tax information. If you or anyone in your household is in a situation where they aren't likely to be eligible for the options we went over due to immigration status or other reasons, there may be other options for them. Some of these include emergency Medi-Cal, off-exchange coverage. They can also contact the list of service providers on the California Department of Social Services website. They can check the county for local safety net programs, and they can refer to the PIF reference guide on health programs available to immigrants during the COVID-19 outbreak. No matter what type of coverage you might qualify for, here are some important reminders and deadlines. The state mandate requiring California residents to have health coverage is still in force. There will be a tax penalty for those who go without coverage. Penalties start accruing after the 4th month without coverage. Use the tax penalty calculator to estimate what your tax penalty might be if you go without health coverage. Due to the COVID-19 outbreak, Californians may now enroll into individual and family health coverage through June 30th. This applies to both on-exchange and off-exchange plans. Here's a simple chart to show timelines for applying for and starting coverage. Now that you have a better understanding of your non-employer sponsored health coverage options, the next step for you is to identify the right option for your unique situation. If you're working with a broker, connect with them to talk about your recent changes and the options that you think may work best for you. They will be able to help you take the next step to apply. If you're not working with a broker, we have Blue Shield of California team members who are ready to help. Here's the contact information for each program. This is for both off-exchange and on-exchange IFP plans, including families that are likely to have IFP adults and Medi-Cal children. This is for Medicare, which covers people over age 65. And Medi-Cal. If you live in LA or San Diego County, a Blue Shield Promise Health Plan rep can help you. In other counties, you can easily apply online. In this part of the presentation, we're going to dive into some of Blue Shield's IFP plan highlights to help you understand some of the features of this type of coverage. Blue Shield is currently the largest carrier in the California individual and family plan market. We offer both PPO plans as well as HMOs. Our exclusive PPO plans may be for members who are looking for a large choice of doctors, specialists, and hospitals. Our exclusive PPO network includes 52,000 doctors, including 33,000 specialists and 320 hospitals. It offers flexibility and choice of where you can receive your care. The plan is available in all 58 California counties. Blue Shield also offers HMO options. Our Trio HMO plans offer high-quality networks of local healthcare providers working together to take care of your health. Shield Concierge offers a single point of contact that makes navigating your Trio HMO plan and getting the right care faster and easier. Predictable costs. The Trio HMO product is available in 26 California counties, which are listed below. Another feature of Blue Shield's IFP, PPO, and Trio HMO plans is Blue Card coverage for emergency and urgently needed care when members are out of state or out of the country. Members will have access to providers for covered services outside of California when urgent and emergency care is needed. We're proud to say that this is a robust network, with over 90% of providers in the U.S. belonging to Blue Card's national network. Also, more than 200 countries worldwide belong to the Blue Card Worldwide Network. When using Blue Card providers, our members get to take advantage of pre-negotiated rates. If your change in health coverage status also includes a potential loss of coverage in your dental or vision plan, you might want to consider affordable options with Blue Shield. The good news is that all of our IFP plans for children age 0 to 18, both on and off exchange, include dental and vision coverage at no additional cost. For adults age 19 and older, our dental plans start at less than $14 a month, and vision plans start at less than $7 per month. In addition, if you can demonstrate that you've had coverage for 12 months or more, Blue Shield can waive the waiting periods to access services. It's important to remember that to take advantage of waived waiting periods, you must apply within designated timelines. These are other options you can ask your broker or a Blue Shield representative about. Here's some more information on Blue Shield's exclusive PPO plan, offered both on and off exchange. We're the only IFP carrier in California giving members access to doctors and hospitals in all 58 counties. No referrals are needed to see these providers. For instance, a member in Sacramento could choose to obtain care at UC Davis or Sutter in Northern California, or they could choose to go to UCLA, Cedars, Hoag, or Scripps in Southern California, and vice versa. Here are some special features of the Trio HMO plan, including Shield Concierge as your single point of contact for your healthcare needs, Healthy Savings grocery store discounts, providing over $50 in promotions each week at large grocery store chains across California and the U.S., LifeSpring free meal delivery service for eligible members experiencing serious illness, free non-emergency medical transportation through Call the Car for members experiencing serious illnesses. Blue Shield makes it convenient for our members to access care virtually. Keep in mind, you can always make an appointment to see your doctor or visit in urgent care. These are additional alternatives Blue Shield provides you. Nurse Help 24/7 gives you immediate and reliable health advice from a registered nurse. Teledoc, which is a doctor visit over the phone or video chat, is for non-emergency situations. Teledoc is a convenient alternative when your PCP or urgent care is unavailable. The Teledoc physician is able to prescribe your prescription meds that can be sent to your local pharmacy. Our members can also search for mental health providers, as well as see who can provide care virtually through teleconference. Many online resources are available, such as articles, videos, and webinars. For members in certain urban areas, the HEAL program provides an on-demand house call service where a physician can meet you at your home, work office, or even a hotel. Our Wellvolution platform offers access to a variety of mobile apps to help members meet their individual health goals at no cost to them. This concludes our non-employer sponsored health coverage video. Thank you for joining our Blue Shield presentation today.